You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast. Thank you so much for joining me in today's episode. I'm going to be talking about myofunctional therapy. If you don't know what that means, then hold on and hang on in there because you soon will. It's a type of treatment that is supposed to help improve growth and development of the jaws and therefore the position of the teeth. So I'm going to have a look at whether this actually does what it says on the packet or not. But if you want to know more about holistic dentistry and the links between your oral health and your overall health and well-being, then you can hop on over to holisticdentistry.au or check out my dental practice, evolvedental.com.au here in Brisbane, Australia. And our phone number is 07 3720 1811. But for now, less about me and more about today's topic. Let's get in the zone. So let's look at myofunctional therapy or oral myofacial therapy. Now, this is considered to be a profoundly useful treatment that may help treat the symptoms of a wide variety of health issues, from opening the airways to improve breathing, to supporting in treating headaches, temporomandibular joint disorders or TMJ, and then things like poor digestion, anxiety, and speech, just to name a few. And it's probably, according to the myofunctional or myofacial therapists, one of the most profound treatments available for mild to moderate sleep apnea. Now, myofunctional therapy is labelled as the neuromuscular re-education or repatterning of the oral and facial muscles. The therapy includes facial and tongue exercises and behaviour modification techniques to promote proper tongue position, improve breathing, chewing, and swallowing. It also addresses proper head and neck postures. There are good studies that substantiate that it may resolve jaw problems and orthodontic relapse when working with a multidisciplinary team. It has also been suggested that it might be an alternative or adjunctive treatment to facial plastic surgery to get rid of lines and sagging facial muscles. And in Brazil, in particular, some myofunctional therapists do work with plastic surgeons. Now, I am a little bit skeptical when it comes to myofunctional or myofacial therapy, because there are certain things that we can do while the skeletal bases are still growing and developing, so that's the shape of your face and your jaws. But there's very little we can do once you're an adult and those bones have finished their growth and the plates of the jawbone, particularly the upper jawbone, are fused together. Yes, I do agree that no different to speech therapy, that training the tongue and the muscles can have benefits on breathing and the position of the jaw being held more comfortably, which can improve TMJ and headache issues. Obviously, if you keep your muscles nice and toned, just like anywhere else in your body, that's going to prevent you from looking saggy and baggy. Now, this type of therapy is being touted to young growing children, to the parents of young growing children, that if you wear a myofunctional appliance, which is just basically like a little soft, chewy night guard that keeps the lips and tongue and cheeks of the teeth, then the jaws will naturally grow into a perfect U shape and you'll never need orthodontics. That it's going to maximize the growth of the jaws and you won't get an overbite or an underbite or problems with your bite. Now, I think that what I'm seeing happening with this is then parents are locking their children in to courses of treatment with these myo braces and these myofunctional appliances from about the age of 6 to 12 or 13, and then the dentist or myofunctional therapist is going, oh, look at that, look how awesome the growth of their face is, look how nice their profile is and their arch alignment, and they're putting it all down to the fact that this poor kid has spent 6, 7, sometimes 8 years in a brace appliance, when, in all truth, normal growth with or without the appliance, would have achieved the same result without putting the kid through 6, 7, 8 years worth of myofunctional braces, plus all the expense of those appliances and the numerous visits that they have. So I think a lot of these cases where they're going, look how well this works, would have been achieved just by the child's natural growth process. Then those it doesn't work for, where they still end up with orthodontic issues, they try and say it limited their problem and now they're only going to need 18 months worth of braces. Well, I'm telling you that in most cases the kid would have developed the same problem and needed 18 months worth of braces without the 6, 7, 8 years prior of being in a functional myobrace appliance. But when it comes to oral myofacial, which is muscular exercises and tongue positioning, that has some merit. So let's just backtrack a little bit, because I am ranty Dr. Rachel today, because I am tired of seeing people being taken for a ride, where they're being sold something that sounds very plausible, but is actually based on bullshit. It is based on hypotheses with no proper studies, and it's anecdotal, and I have seen patients harmed from poor intervention, and wrong treatment recommendations. And then these teenagers and young adults have to go on to have very serious surgical correction done because myofunctional and myotherapy was going to sort it all out. So this is why I'm a little bit narky, a bit annoyed about this subject. So I'll just take a breath. We'll take a step back and go, well, where does this idea come from? Well, first of all, if you can balance the harmony of the pressure of the muscles against the pressure of the tongue and proper tongue position, in theory, you should develop a very nice profile, a full and uncrowded and U-shaped arch. But this isn't always the case, because then we've got genetics, we've got skeletal discrepancies, and we've got growth discrepancies. So just keeping the muscles in a neutral position on their own is not going to always be sufficient. But when we see adults who have got these nice shaped arches, they have got a balance between the muscular of the tongue against the lips versus the muscular of the lips and the cheeks. So I can understand why we would go, that must be why they end up with these nice broad U-shaped arches. But I think it's negating genetics, racial disparities, and so forth. Anyway, there are health problems that have been said to relate to poor orofacial function. And most people who have these problems have no idea that they stem from dysfunction of their mouth, which is more primarily the tongue position, where we hold our tongue during rest, its passive position, where we hold our tongue when we swallow, and where our tongue contacts when we speak. So there's the dysfunction of the tongue, then there are our breathing habits and forward head and neck muscle function. So in these instances where we have poor tongue and poor head and neck posture, then something like myofunctional therapy and physiotherapy can work quite well, particularly if you've got a tongue tie and you're considering a tongue tie release, which I won't go into in too much detail on this podcast, but we will be touching upon it, and I will probably do a whole podcast just on tongue tie and all the myths and pros and cons around that as well. So tongue tie is best dealt with in infancy. So I see a lot of patients who have mild and moderate tongue tie and have no idea, because they were able to latch and breastfeed properly. They don't have speech difficulties and they don't have swallowing and breathing issues. Now, I'm one of these people. I have a mild tongue tie, and now I've had my teeth straightened. Because of that tongue tie, my tongue can't stretch all the way to reach behind the top of my front teeth the way it used to, and it has left me with not quite a lisp, but a little bit of a slushy S sound when I'm talking, and you may be able to pick up on that on some of the podcasts, particularly when I'm ranting or talking fast, or maybe I'm a little bit tired from the day when I've been presenting and my speech gets a little bit sloppy. Now, tongue tie often goes undetected in young children because they fail to connect the issue with breastfeeding problems, and they just get the baby on a bottle. Now, I'm not for or against breastfeeding or bottle feeding. It comes down to personal choice. It comes down to the individual. It comes down to the baby. But when feeding issues are present, such as pain on breastfeeding, thrush or mastitis, poor latch, inefficient emptying of the breast, poor infant growth, reflux, sensory issues, poor gut function, and poor sleep, then these are things that can indicate that tongue tie is an issue, and reaching out to a lactation consultant is the way to go to have an assessment and direct you to the proper resources, and having a look at proper revision using either a laser or being snipped with scissors, which I think is actually better than laser because you don't get scar regrowth, and then some supportive structural therapy in that instance. Tongue ties dealt with young are probably the way to go. Now, oral myofunctional therapy is gaining popularity, and it was really big in Brazil. And in the US, there's now an Academy of Orofacial Myofunctional Therapy, and they're offering courses and certification in the practice, and they're also addressing tongue tie and things. But I think some of the information is a little bit misguided, and I'm not sure how beneficial it is in older children and particularly in adults itself. Yes, I have seen instances with patients where speech therapy, oral therapy, physio, working with the jaw muscles, working with the tongue position has been helpful, but I don't think it's the be-all, end-all, panacea, fix-all thing that they're selling it as. And I think these myofunctional appliances that they're saying this is going to prevent your child from needing extractions or orthodontic treatment, it's not all it's cracked up to be. And I'm just encouraging everybody to do their research and really look into this. So myofunctional therapy has been around probably about 35 years. I've seen some shocker cases. I've seen some really screwed up mouths because this has been handled incorrectly. And I'm saying tread carefully here, guys. I'm not for it and I'm not against it. I'm a bit of a fence sitter, and I think I would err on the side of caution. I hope I've got that point across. So we see these children who have breathing problems, they're bedwet, they've got anxiety, they've got mouth breathing, head forward posture, dark bags under their eyes. They can be failure to thrive. They can be labelled as ADHD. I think a lot of these kids have got apnea. They've got sleep apnea, and that needs to be addressed, and that can be supported with proper orthodontic treatment and oral myofunctional therapy and occupational therapy. So basically, myofunctional therapy is a lot of exercises for your lips, cheeks, and particularly your tongue that involve how your facial muscles work. So it doesn't just address your oral cavity and tongue. It's supposed to work with all the facial muscles and the head and neck. It's a way of teaching you to breathe through your nose, and I am all for that. It teaches you how to rest your tongue properly against the roof of your mouth and gives you exercises for your facial muscles so you work on functional posturing and functional chewing. And if you're not chewing your food enough, then your body works overtime having to digest it, and then your chewing muscles aren't helping your jaws and teeth develop properly. So if you're an adult, that's probably a little bit too late, but we can see some things that might be beneficial. Now, many people have braces, and afterwards their teeth move. Their teeth relapse. And most patients say to me, it's because I didn't wear my retainers. Well, the problem is you got crowded teeth because the size of your jaw, size of your teeth, and then the musculature pushing upon them. So if the muscles are still pushing, then your teeth won't retain the position that they're in because the muscles haven't changed and adapted to their structure. Now, they're saying if we can prevent this problem from a young age, then you should end up with less crowding. And I don't know, maybe you do. But chewing is very important. I might stop for breath soon. How about we just have a moment? All right. When I'm on a rant, it just comes out real quick, guys. So you may have to just play it a little bit slower, go back to listen to the bits you want. I don't really have a lot of notes today, so it's all just coming off the cuff. And that may make it a little bit more difficult for you to follow me today, so I am sorry. I'm Dr. Rachel Hall. This is the Dental Zone. It's my show, and sometimes this is just the way it comes out. Now, chewing's important. Now, most people, probably myself too, don't chew their food enough. Now, this leads to poor digestion, poor nutritional uptake, and can cause other health-related, can cause other health problems. When you chew properly, your food is physically broken down. It increases its surface area. This helps to enhance the enzymes of the salivary amylase, and that helps to partially digest the starches in the food. It kind of helps to pre-digest the food, and it signals to your stomach that food is on the way. And there's a very specific reflex that goes from your jaw down into your stomach and your digestive tract, which stimulates the secretion of your digestive enzymes. Now, if you're not chewing properly, you don't have enough enzymes produced to break the food down and metabolize it properly. And that can cause failure to thrive in a child who finds it difficult to chew comfortably. Now, kids who have tongue ties, if it's not going to the roof of their mouth when it swallows, then you don't get the right, this is what they say, you don't get the hormones released from your pituitary gland. Look, I don't know how true that is. it sounds plausible, and again, it sounds like it could be just complete woohoo. But apparently what happens is that the pumping action of your tongue going up onto the roof of your mouth during swallowing, which can be anywhere between 500 to 1,000 plus times a day, is supposed to help expand the growth of the jaw, expand the nasal cavity, and position the sphenoid bone to secrete the hormones from the pituitary gland. Now, I don't know anything enough about that and the endocrine system to be able to comment on that. But yes, if your tongue pushes up against the roof of your mouth, it helps to shape your upper jaw, which therefore helps to shape your nasal cavity. Now, myofunctional therapy exercises train your tongue to rest on the roof of your mouth. Now, people think your tongue is a muscle, but it's actually an organ with very strong muscles in it. It's one of the strongest working groups of muscles in your body, and the job of your tongue is to protect your airway. It's to encourage normal forward facial growth, and when it's postured correctly in the roof of the mouth, it aids speech and it moves food around when chewing and swallowing. Now, if your tongue is restricted due to a lingual frenulum, which is the bit of skin that can attach, or the string underneath your tongue, if that's too tight, you're going to have a hard time moving food into the molar area, which are the big chewing teeth at the back where all the chewing is concentrated, and you're not going to be able to chew properly. Often people with tongue tie will have a strong gag reflex, so they can choke and gag on food, toothbrushing, swallowing tablets, and they'll also have issues with textures of food. Now, I don't like slimy foods. I do have a bit of a tongue tie. Things like banana, avocado, kiwi, mushrooms, those sort of slimy foods make me gag. Even just talking about them makes me want to gag. Having a cotton roll put down beside my tongue and teeth when I'm getting dental work makes me gag. It freaks me out really badly. And so I can understand that if someone's got a tongue tie, this is going to be an issue for them if they can't get the food to the back of the mouth and chew properly. Now, your tongue is connected to your hyoid bone, which is in your neck. And if it's not functioning properly, you may end up with a forward head posturing position because you've got to protect the airway. Now, if your tongue rests down and forward, that can be just enough to pull your entire head forward and throw you out of balance. So, what are some disorders that may benefit from myofunctional therapy? Now, there are a large percentage of people who claim that, I'll just reword that. That's not what I was trying to say. There are a large percentage of people who have orofacial disorders that would potentially benefit from myofunctional therapy. Now, the reason that these high numbers are prevalent is because people have got situations that prevent their tongues from functioning correctly. And these are things like mouth breathing, sucking your thumb or your finger, baby bottles, dummies, pacifiers, having a tongue tie, eating too much soft processed food, and supping from sippy cups. How many adults do we see these days supping from their coffee sippy cups? Hello, guys. Have we not grown up? Are we not weaned that we now have to have our coffee from a sippy cup? Anyway, I won't digress, but it's one of the things that drives me freaking mad. You might now want to switch off because you've decided that I'm a bit of a bitch and you don't like me, but hey, I just don't get it. Can't we drink out of a cup? When I was a kid, I didn't want my sippy cup. I wanted to be grown up. Why are we not grown up? Anyway, doing that is bad for your jaw and your tongue position. When a child mouth breathes, this in turn can actually lead to learning disabilities and behaviour problems because the child's not getting enough oxygen to the brain. Mouth breathing promotes allergies and other common ailments. And once your tongue doesn't function properly, it affects your oral posture and your ability to breathe correctly, and it can cause your airway to collapse. Mouth breathing encourages a low tongue posture, which then puts your jaw out of position. Now, if you want to correct a muscular disparity in your body, what do? You do corrective exercises. You go to the gym, you lift weights, you do stretches, you do exercises that are helping you strengthen and correct those weak muscle imbalances. Now, they would then make sense to me that if you've got a weak musculature in your tongue and your face and your jaw, that you should be able to do some corrective exercises and strengthening exercises to influence your ability to chew, speak, swallow, and breathe correctly. So, should you consider going to see a myofunctional therapist and having myofunctional therapy? Well, if you do, what they're going to do is they look at habits, such as, do you consume dairy products? How warm is your bedroom when you sleep at night? And do you get frequent nosebleeds? Do you get colds? Do you wear ill-fitting glasses that slip down your nose? Can they teach you to breathe? These sort of things teach you to breathe through your mouth rather than your nose because your nose is not functioning properly. Have you got deviation of your septum? Have you ever had a broken nose? Have you got sinus problems? All sorts of things that can go on. This initial evaluation is done so that they can devise a treatment protocol. There are hundreds of exercises that you can do for myofunctional therapy. Just go look it up on YouTube. You'll be blown away. And then I guess the therapist is going to say to you that just like a physio or sports exercise person, that you can't just go pick a few random exercises and expect that to fix your problem, that there are going to be individual ones that fit you as well as some basics that will underpin everything. So in order to repattern all the muscles involved in your breathing, chewing, swallowing, you apparently will need to do it quite slowly over time and reprogram your muscle memory. And this is where you're then having quite a few visits with the myofunctional therapist. And I'm not knocking it. I'm saying it can work. But you've just got to sometimes take some of what they're saying, some of the claims that they're making with a little bit of a pinch of salt and just apply some common sense. So I'm not going to talk about the exercises, but if you feel this is something that would benefit you, then I would urge you to find a trained therapist who can customize the exercises to your specific anatomy and problem and go into a coaching relationship with them. There are different parts to the therapy, and you've got to kind of sequentially activate the orofacial muscles and get the muscles working to help the lips stay together, get nasal breathing happening, get a lip still, get the tongue in the right position. And at first it can be quite difficult. Some of the things they use are like Buteco breathing exercises. It's supposed to reverse over-breathing and hyperventilation. And a lot of people do not breathe properly. Yes, you're still alive, you're breathing, but they don't breathe properly. They breathe in a way that engages muscles that should not be engaged in breathing. They breathe in a way that's too shallow, too rapid, and that creates the feeling of anxiety and the release of anxiety hormones into the body. So breathing exercises are important. Then chewing. You've got to actually break up and manipulate the food into the correct place, chew your food properly. Then you've got to work on where you're swallowing, where your tongue is going up and back rather than down and forwards. And then we've got to even train this to happen in our sleep. Then we'd look at functional posturing. I'm doing it right now. I sit terrible because I've done dentistry for over 35 years. You get this head forward tilt position, and then if you're in this weird, so we get this forward posturing. Now, if you sit with your head forward and tilt it up slightly, it's really impossible to swallow comfortably, but that head forward posture is what someone learns to do because they can't get their airway working properly, and then that causes an alteration in their swallowing mechanism and it adds to muscle tension. And then we've got the chicken and egg catch-22 scenario. So if you can correct functional posturing and have exercises to correct your tongue position, then your body's going to adapt. The goal is to get your lips closed all the time, except when you're speaking and eating, because your nose's main function is inhaling air, getting the oxygen in, filtering the air, warming it, moisturizing it, and killing microorganisms with the natural production of nitric oxide from your sinuses. Those things don't happen when you mouth breathe. There's also enzymes that are excreted by the little hairs in your nose that have an anti-allergy effect on the body. So it's much healthier to breathe through your nose because you get more oxygen in and you maintain a normal carbon dioxide level. Now, myofunctional therapy can be used in a number of areas to address a wide range of problems. Speech pathologists use it all the time. If your tongue is restricted or you're swallowing down and forward, you're going to talk with an S lisp. If the sides of the tongues are not activated, which is what I have, then you're going to sound a little bit like Donald Duck when pronouncing words like sucker or succotash. Now, I have worked really hard on being able to say those words. I have to speak a little bit slower. You think I'm talking fast now? I am actually enunciating really well. I'm opening my mouth properly and I'm really concentrating on where my tongue is because I'm producing a podcast. But in normal everyday conversation, that's too draining and tiring for me to be so mentally active with it that I do have those slushy side of the tongue S sounds that make it hard to say succotash because the sides of the tongue are too lax. They're weak muscles, a bit like having great abdominals, but the obliques, the side muscles, aren't toned and strong. But by tightening and toning and repatterning the muscles of your tongue, it does enhance some speech disorders, and physical therapists and speech therapists are really onto this. They're also starting to see that with exercises, we can get TMJ problems to resolve. We can reduce problems with the jaw and jaw problems. And this is something I do a lot for my patients when they come in with TMJ. Dentistry would normally, first thing they do, jump into making an occlusal splint that you wear at night to reduce the clenching and crushing forces on the teeth and jaw. And I do agree with that. But if you do that in conjunction with head and neck and facial physio, they get much better results. Now, dentists and dental hygienists would be a good fit for myofunctional therapy because mouth breathing is one of the major causes of dental diseases. Drying out the mouth leads to an increase and overgrowth of bacteria, major cause of periodontal disease, major cause of tooth decay, and then that mouth breathing and poor tongue position is supposed to cause, add, and mitigate problems with malocclusions, that's bad bite, crowded teeth. You need The bacteria in your mouth, sorry, I'm all over the place today. I've got so much to share with you. The bacteria in your mouth need air to live. So when you're mouth breathing or just resting with your mouth open, you're supplying those bacteria with their much needed oxygen, and that makes them stronger and more virulent. And the plaque, the biofilms that the bacteria form is much thicker. Then if you mouth breathe, your tongue drops down rather than resting up and out against the teeth, and that can cause the arches, the dental arches, to collapse, not the feet arches, leading to crooked teeth. So if you've got some of the risk factors indicating that you might be able to benefit from myofunctional therapy, then I'm going to go through the list. This may be something that works for you. Now, if you consume a high sugar diet, then muscular therapy is not as effective because your ability to focus and have strong muscles is actually limited, apparently. I don't know why. I don't understand the link between that, but that's what I've heard. So if you decide to go into this coaching relationship, I would call it, with a myofunctional therapist, then you've got to pay attention to your diet, because they're saying that that can have an impact. So if you've got some of the following things, then you might benefit from some myofunctional therapy. Now, I think it's great from strengthening the tongue position, oral musculature. I don't think there's any issue with that. It's when they say that this is the way to prevent your kids from having orthodontic treatment, and then they get them in these appliances for years on end. That I do not agree with. Okay, so if you've had orthodontic relapse, you've got long face syndrome, you get frequent headaches, you get bloating due to swallowing air, you have nail, lip biting or other oral habits, you snore, you were bottle fed, you've got speech problems, TMJ problems, food texture sensitivities, which I did mention earlier, frequent choking, gagging or trouble swallowing, which I also mentioned earlier, developmental delays such as low muscle tone, you've got allergies, there's thumb sucking or a history of thumb sucking, neck pain and mild to moderate sleep apnea, then myofunctional therapy may be of benefit to you, and it may support you to improve some of these conditions. I'm not saying it's the be-all and end-all, but the nice thing about it is it's non-invasive and it's not something that's irreversible. You just got to be willing to take the time and invest some of your hard-earned cash into it. And like I said, it's not a hard science, but just like exercising your body, you're going to see differing results between differing individuals. It's going to work for some and not so much for others. Now, there's some simple techniques that you could probably try right now if you're still listening to me ranting on. But, like I said, if you're going to work on this, then you probably want to work with a professional who's going to do something for you. But there are some things that can support you. Sleeping on your back. This helps your posture and it helps open up your airway so you can breathe better. Now, if you are like me and you find it hard to sleep on your back, you may have sleep apnea, you may have reflux. Then the way to do that is to raise the headboard of your bed the size of a brick so that your tongue does not drop into your airway. Now, you do that by just putting some boards under the head end of the bed. Now, sugar is refined. People don't have to chew to break down their foods. So I want you to start eating unrefined foods that are chewed more, and therefore it makes the muscles work. You can chew on some biltong, that sort of thing, but more chewy food. Then another thing is to actually stop touching your face. Now, I probably touch my face 1,000,000 times a day and don't even realize it, but certainly not resting your jaw on your hand or, that sort of thing, because that's going to interfere with your posture. And try and work on keeping your tongue firmly in place against the roof of your mouth. People have this tendency to lean on their hands, they touch and play with their hair, they're biting their lips or they're biting their fingernails, and all these little habits are things that we do to stimulate endorphin production, and it's a real feel-good sensation. And this is why people suck their thumb, they touch their hair, they touch their face, and they have these little chewing habits. But what happens is you affect your posture and you put pressure on your jaw and face, and then you're messing up your muscle function. Now, the theory is that when your tongue rests up into the right place, that stimulates that endorphin sensation that we're trying to mimic from these other habits. So it's going to push your tongue up against the roof of your mouth. It says it's going to help maintain the proper development of your arches. It's going to encourage your teeth to line up correctly. It's certainly going to help you breathe better. You want your tongue to rest behind the first ridge on the roof of your mouth, not pushing up against your teeth. Just those little grooves in the roof of your mouth, they're the resting place for your tongue. Some people have very sharp ridges because the tongue doesn't rest there and nothing pushes up against them. A lot of people with TMJ pain and headaches, we make splints and we make appliances, and sometimes it doesn't help because of the muscle patterning, the muscle function. And this is where we then support people with the physio and the myofunctional exercises to get their muscles working correctly, correct any habits, and get this swallowing in the right place. Now, grinding and clenching is another sign you need to retrain your orofacial muscles. Grinding is often related to some form of sleep disorder, usually upper airway obstruction, and the body attempts to move the jaws to get the airway opening because things just aren't working properly. If you can get your oral facial and neck muscles working properly, that can make a huge difference. Some people say it can change the way your face looks, and it may actually change your facial structure, and that your skull bones shift in a slow and comfortable fashion. I don't know how true that is. I'm going to take that one with a pinch of salt and let that one sit out there. Now, if you want to find a myofunctional therapist, then if you're in the US, you can look up the Academy of Oral Facial and Myofunctional Therapy. They do have a website. I don't know whether you can find therapists elsewhere in the world. There's myofunctionaltherapy.com. You can look up myofunctional therapist. You can sometimes do some of this via Zoom or Skype, so you might be able to do it whether you don't live in the same country or not. But just make sure you do your research properly. You can look for a speech pathologist. There are some dentists and orthodontists who are trained in this. You might want to work with a sleep medicine doctor and a physical or occupational therapist as well. It's all about constantly learning new information. There are things that you may find work for you. You may find you try this and it doesn't help at all. But of course, I want you to eat a great diet, exercise. But if you're not sleeping, breathing and chewing well, that can impact on your overall health and well-being. So if you'd like to know more about this, then certainly go look it up. Do your research. I'm very happy for you to do facial exercises and tongue repositioning. I have no qualms about that. It's not going to do any harm, but I would encourage you to think very carefully if the orthodontist or the dentist is trying to encourage you to have myofunctional appliances and wear these things for years on end, because then your child's going to be a little bit like all these other kids I see. Were like, oh, I had 10 years of braces and it didn't work and it all relapsed and now I've got to have braces again, and they're very upset and disappointed, and that's because basically they've been BS'd. Do the exercises, let your muscles work. If you need to get your crowding corrected, then by all means get that done. And hopefully this has been useful. Hopefully it's given you some ideas. Maybe it's a starting point. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Hop on over to holisticdentistry.au. You can give our rooms a call to book an appointment, 0737201811. Thank you so much for joining me once again. This is the Dental Zone podcast, and until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.